in various states, some states have more sort of these compounding pharmacies than others. The other component is that we live in an insurance-based model, and that's why the conventional model plays such a large role, generally with customized medicine or essential oils or dietary supplements. A lot of these integrated modalities that people have to be they have to have this motivation to be a searcher and a seeker. And that usually happens because of some sort of ailment or some sort of short-term suffering. And out of that suffering comes this, you get backed up into a corner and you have to take action and do something. The integrative model is cool because you come in thinking about that initial chief complaint, but you come out of it a better person because you're taking those small habits and sort of building on them on a day-to-day basis. So now you came in with the chief complaint, but you come out as a better person.
Welcome to the Exercise is Health podcast, where we're talking about exercise, health, and the interconnectedness of the two. We are your hosts, Charlie
and Julie,
and we will be coming to you every single week from our studio, Muscle Activation Schaumburg. Hey, welcome back, everybody, to the Exercise is Health podcast. We are your hosts, Charlie
and Julie,
and we are coming to you from our studio, Muscle Activation Schaumburg in Schaumburg, Illinois. Now, at Muscle Activation Schaumburg, we believe your health is your most valuable asset. Your health is one of the biggest influencers of the quality and quantity of time that you have. And while there are many aspects of health, our expertise is exercise. Exercise has been proven time and again to not only improve your health, but also increase your longevity and improve your quality of life. But we know that exercise is not the only piece of the puzzle, and that is why we are bringing you a rock star guest today, none other than Dr. Matt Dhingra. Dr. Matt Dhingra is a registered pharmacist and functional medicine certified through Functional Medicine University. He received his Doctor of Pharmacy at the University of Illinois, Chicago. Matt has a strong sense of service towards advancing our healthcare model by focusing on sustainability and unlocking our body, mind, spirit potential. Matt specializes in responsible pain management, opioid withdrawal, and assisting physicians with reducing the dose and frequency of medication in their patients. Matt enjoys collaborating with other practitioners to create a more integrative model that creates a co-creative experience with the patient to achieve better outcomes. Matt currently provides private consultative services and works with several compounding pharmacies in the area. Matt, thank you so much for joining us and welcome to our show.
Hey, thank you so much. Thanks for having us.
Oh my gosh, our pleasure. Absolutely. So talk to us more about kind of your beginnings from an educational standpoint, how you got interested in medicine, and then how you started to specialize in pharmacology.
Yeah, so probably there's a bit of a family component. My father was an independent pharmacist as well, and he had done that for the last 30 years. So when I was as young as 16 or even younger than that, I was working in his pharmacy and had some access to that experience and counting medicine and learning a little bit about what they do. And I always found that very interesting. With respect to pharmacy school, I was a student here at UIC and I found it, it was a great educational experiences, and it's one of the best schools out there. The one challenge that I always noticed is that whenever we would do sort of this mock thing with the patient and what medications to put them on, I always realized that the answer to their question was always add more medicine or add more medicine.
Mm-hmm, mm-hmm.
And it always kind of made me think, is that really the only option that we have? And so the conventional model sort of started to define itself in my brain, and I thought, there has to be more to this. So then after graduation, I did spend some time in Southern California, went to a small college called Emperor's College of Traditional Oriental Medicine in Santa Monica, did some part-time classes there. And then, as you guys know, once you get, obsessed or passionate about something, that has a ripple effect and it continues to snowball as time goes on. So that process happened. And fast forward to 2007, we started a small independent pharmacy in the south suburbs, which was more of a conventional model. And then the opportunity came to start something from scratch as early as 2015 when you and I all met. Mm-hmm. And we were able to create this concept, which isn't the first of its kind, but a concept that allowed access to conventional pharmaceuticals and go through that conventional process of billing insurance, etc., but also add some additional tools to the tool belt and create some opportunities to hope to improve for better outcomes.
That's awesome. Now, I definitely remember like when we were first starting our business that, when we moved into, I guess, technically our second office, within a few months, I think you had opened your spot as well. So I definitely remember that like distinctly going and, presenting at your location, at your pharmacy and, talking to people there and going through a whole presentation. So yeah, I mean, it's just been a lot of fun kind of, I remember that right at the very beginning of essentially us, within the first year of opening our business, kind of having this connection with you. So thank you for, kind of letting it come full circle in a sense and being on our show now.
Yeah. And I remember when you first started, no podcast,
podcast,
and lots of lot of changes,
definitely
for the better, and it gets exciting when you can sort of grow and see where you are now versus where we were 3 years ago.
Right.
Yeah, thank you. Well, Matt, tell us a little bit more about what kind of topics and ideas did you guys learn and cover and explore in your schooling when you were in California?
Well, of course, this is there's nothing out of the ordinary about this. These are things that resonate with you guys as well, and it's just basic concepts that we've all heard many times over. One concept is the importance of movement and what that can do for our brain and our cognitive support. Other concepts are what food can do for us when we incorporate that into our lives in the proper way. As time went on, we learned more about inflammation, and we started to learn about how certain foods can be more pro-inflammatory and certain foods can be less inflammatory. So what's the point of taking medicine unless we can't have this conversation about these basic things that allow us to be who we are? It just didn't quite make much sense. And I'm noticing in the conventional world that a lot of practitioners and doctors who work within these larger institutions are starting to feel it as well. And, they're also reaching that point where they're like, there's got to be more to this. And I'm hearing more and more doctors getting sort of tired of that, having to see 25, 30 patients per day on the clinic days without more. So there's a level of unfulfillment that I'm seeing kind of permeate through. And I think the benefit of the integrative model is it's a co-creative experience. Patient benefits, the practitioner benefits. We all benefit because we all kind of learn from each other and we get better over time.
Mm-hmm.
Definitely. Now, continuing on with kind of your time in California, did you find that a lot of your classmates were already, had completed med school or had completed pharmacy school or something of that nature? Or were people coming in, relatively raw and you were more of a unique case where you were in the kind of traditional medical school path or going down the traditional medical school path before you went into the school in California?
So there were a few folks who had a nursing background. There was just one or two folks who had a pharmacy background, maybe one medical doctor or one physician assistant here and there. The rest they did have a science background, but they weren't necessarily fulfilling that whole conventional degree. So it was a blend of everything. Many people with from yoga to Pilates. Many people who were just interested in health, acupuncturists, herbalists, who wanted to extend that scope of practice and see what the potentials were. So that's how that process snowballed. And then from there, people kind of took it where they wished. If they wanted to become a licensed acupuncturist, they would do that. Or an herbalist, they would do that. If they just wanted to take little pieces and not necessarily complete the licensed acupuncturist program, which I did not do, then you can take what you learn from there, begin to network with other people who do that, and maybe end up working with those types of folks down the road, which is what we did. When we opened the pharmacy, we did have a naturopathic doctor on the team, and at some point we did have a licensed acupuncturist on the team. So when customers would come in, it brought me a great deal of bliss when they would go and see our acupuncturist or have a consultation with our naturopathic doctor, because I knew that they were getting something very rewarding and very unique in a pharmacy type of a setting.
So Matt, if you wouldn't mind, I think, just because Charlie and I have known you for a few years, we're a little more familiar, but for our listeners, could you share more about what is this conventional model that you're talking about? And where are the holes and what are you doing to fill those in to turn it into this integrative model that you're talking about?
Yeah, so the conventional models is generally what we would normally see when we walk into any type of a big box pharmacy outlet. You have some sort of a prescription. That prescription gets processed through the computer pharmacy software system. That drug has a national drug code, gets entered into the system. Either the patient pays for it out of pocket or their insurance pays for part of it. We tell them what the price is, and then they either decide to pay for it or not pay for it. And so that's sort of the conventional model. If they decide not to pay for it, then we can either contact their prescriber and ask for something else, or if their insurance doesn't want to pay for it, we can start the process of a prior authorization process. And that's pretty much it. They continue to take the medicine for as long as they need it. In most cases, if it's for a chronic condition, then they end up taking it for years. And that's the end of that story. The three things that conventional model look at are, surgery, some sort of a procedure, medicine. We want to focus on improved quality of life. We want to focus on improving the lab values to quote unquote within normal limits, whatever that means, and to address that chief complaint. With the more integrative model, all that is critical. There's no question that the acute care model in this country is unbelievable, especially for those of us who've had to experience that, whether it's something like childbirth or having a family member have some sort of a procedure. When that procedure happens, it is truly a miracle when you get great doctors and nurses together with the technology, and what seemed like something that's crazy it becomes so routine. Mm-hmm. With the holistic model, it just allows a chance to have more tools in the tool belt and collaborate more with other practice modalities. So I think the easiest way to do this is to talk about maybe some sort of condition.
Sure.
So let's just do something really light, like scars. If you talk about a scar, you can go to the pharmacy and get something over the counter. The probability that it's going to work really well is kind of low. And if it does work, it's going to take many, many weeks, if not months. With a more integrative model, you can take a compounding pharmacy, work with a practitioner. You can then add certain ingredients to that topical formulation that you wouldn't be able to have access to commercially available. So you can add one or two pharmaceutical agents that have been known to be helpful for this, and then you can even add some nutritional components to improve that process even more. So that way, maybe you're getting 10% benefit from one ingredient, you're getting 10% benefit from another ingredient, et cetera, et cetera. So now all of a sudden, you're getting 4 or 5 different ingredients in the formulation, and you're improving outcomes by 50%. So you could add vitamin C to that formulation in addition to 2 pharmaceutical ingredients. You could add EGCG, which is an ingredient that most of us know is found in green tea. Put it all together, and now you have this cream that is customized just for you. So that's an example of what an integrated pharmacy could do, which is unique from what we normally hear about. The fundamental component of integrative holistic model is to encourage or entice the body to do most of the work. So we're always reaching for exogenous substances to help us feel better, but at the end of the day, the philosophy is put the conditions in place so that our body's healing capacity improves. And these are why mindful exercise, which is something that you have talked about in detail a lot during your social media posts, podcasts, etc., is so critical. Because in addition to the exogenous ingredients that we're talking about with scars, we can also then have a conversation about food and start consuming foods that have more anti-inflammatory properties to improve that healing process. And then, for example, if we had a procedure on the shoulder, then we can talk about mindful exercise to improve healing time with exercise and blood flow, etc., things like that. So now you have this mind map of things that you can take home as a patient to have a better outcome, rather than just kind of putting your hands up and letting somebody else do something for you. You can now be proactive, and that process becomes more fulfilling for the patient as well as for the practitioners involved.
That's really, really interesting, Matt. I mean, to think about, typical experience going into a pharmacy, and like you're saying, all right, your prescription's called in ahead of time, or you go and you hand your prescription, there's a monetary transaction, you get your medication, and you're on your way. But this is so much more involved than that. And also, I mean, thinking about, okay, my guess is, not having developed, drugs or medicine myself, but my guess is when looking at the development of something, you're thinking, okay, what dosage will affect kind of the majority of the bell curve? But there's also everybody else that makes up the bell curve that maybe that dosage or, that medication isn't just quite right for. And what it sounds like you're doing is saying, hey, you know what? We can take this medication and it's going to, affect the majority of people in this manner, but then we can start to, and I'm guessing you make it right in your pharmacy. You add these different compounds to make it more customized for the patient. So we can say, all right, this is where the standard medication would take you, but by adding in these compounds, you'll get, these type of positive reactions, and we'll be able to, get your body feeling healthier, get you your recovery improving, and like you're saying, kind of stimulating the body to start to heal itself. That's really, really neat. Now, how do people react when they typically come in? Because, I mean, my experience, aside from being at your pharmacy, is, of the typical pharmacy model. So what's that initial experience like for patients when they come in? And maybe they're just expecting, that it might be their first time there. They're just expecting to, get their prescription filled and be on their way. So
expecting a CVS counter.
Right? Exactly.
Yeah.
Yeah, so that you bring up a great point, that there are definitely obstacles to this process. One is that conversation either has to happen in their practitioner or prescriber office, or it has to happen in a pharmacy, or they have to do some sort of research online, or they have had to hear about it from a friend or a family member. So in various states, some states have more sort of these compounding pharmacies than others. The other component is that we live in an insurance-based model, and that's why the conventional model plays such a large role, generally with customized medicine or essential oils or dietary supplements. I don't know in your field if people pay out of pocket or if insurance covers it. Maybe it's a little bit of both. I don't know, but a lot of these integrated modalities that people have to be they have to have this motivation to be a searcher and a seeker. And that usually happens because of some sort of ailment or some sort of short-term suffering. And out of that suffering comes this, you get backed up into a corner and then you have to take action and do something. The integrative model is cool because you come in thinking about that initial chief complaint, but you come out of it a better person because you're taking those small habits and sort of building on them on a day-to-day basis. So now you came in with the chief complaint, but you come out as a better person, mentally, physically, and spiritually, hopefully.
Yeah. And I think really bringing that idea of health, because, I think it's interesting. One of the biggest raps that I think the U.S. gets for how we practice medicine is like, oh, well, they just give pills. And your traditional training is to give out the pills. Like, you're the one giving them. But it's so interesting that you can take the education that you have of that and be able to try to manipulate it, as you said in your bio, by trying to get down the number of medications people are on. And this is so important because, as you said before, and I'm just repeating your words, is that these medications are something that people stay on for years. And that's a big problem because that means that the problem is not being solved if they're just on the medication. One analogy that Charlie and I use with our clients a lot when they get injured or they come in with a brace or a orthotic or something that's supporting their body, physically in some way, is we always say, that's great because it'll help you heal. It'll help you stay alive. It'll help you move or whatever you're trying to do. But the goal has to be, you got to have an exit plan from that. Even if you're on a medication or you're, taped up your elbow temporarily, we have to figure out, well, what can we do, to to get you out of this situation, to make it more lifestyle based rather than my life is an acute care emergency room situation. So that's really unique that you're able to do that and you're able to see things, especially with your background and education in this field, because I think a lot of us tend to go to Google for that, which I'm not sure is like the best idea, especially with dealing with your health.
Yeah, everybody does. Everybody does. That's the first place to go, and then you can go from there.
Sure.
Yeah. So I've visited your location and it's really interesting. You do have your pharmacy counter, but most of the space is alternative things. Like you have your essential oils and your specific supplements that you recommend to patients. How do you dive into that world? How do you balance the two? Because I would think it'd be kind of hard with having people coming in with a mindset of like, oh, I'm going to pick up my prescription, and then you also having to, pick out different things for your store or recommendations. How do you balance the two?
And you probably experience this a lot too with your clients, is you have to meet the clients where they are, right? So before you go into your spiel about what you feel is important for them, you have to understand, a little bit about where they are and what they're interested in. And if they are just coming in just to get their medicine, then we're not necessarily here to immediately procure our value system onto them in any way. We would do that over time, hopefully, as the respect and the comfort level improves and the relationship builds over time. But we don't do anything to judge. We're just here to provide people options depending on whatever wavelength they're traveling. So it is challenging, and we generally would have to have some sort of team member who's educated or knowledgeable about some of the more integrative products. And that does require a strategic hiring component, because we have to have somebody who understands those things and can convey that information to the clients, so that the pharmacist doesn't necessarily have to be doing both. So that does create some challenges, because a pharmacist or myself, when I'm there, sometimes has to use two sides of their brain, and for literally 10 minutes I'm having a conversation regarding regular conventional medicine or calling an insurance company, and then 5 minutes later I'm having a conversation about something else, such as CBD or essential oils or something like that.
Mm-hmm. Yeah.
Well, Matt, that leads right into kind of a big question that I want to ask you. Obviously it's 2020 in Illinois. Marijuana recreationally has become legal. If you're above the age of 21, you can purchase it without needing a medical marijuana card. Now, in your experience, what has the role of, from a medical perspective, what is the role of medical marijuana been? And, what are some of the benefits that you've seen? What are some of the risks that you've seen for people? And, who do you feel like it may be appropriate for?
So sometimes when we learn about CBD online or social media, they kind of want to create that scenario that does no side effects. It doesn't interact with any medicine. And that's not quite exactly the case. With regards to recreational cannabis, we do want to be mindful of the fact that it is for folks who are 21 and older, unless there's a specific medical condition for a pediatric population. But I still don't see any point or purpose for, adolescents to be utilizing it. Their brains are still developing, and we're not exactly sure how it affects them. For folks who are 21 and older, if you want to utilize it for its benefits for pain, or just to calm the nerves, or to assist with sleep, I really don't see any issues with it. I will say that certain classes of medications can interact with CBD or THC. Long-acting seizure medications that have an extended release property to it sometimes don't work as well with it. Not necessarily always, but it is something that has to be considered. Certain benzodiazepines, they bind to the GABA receptor, and there is a component of CBD that does bind to the GABA receptor as well. So in some cases, not all, but in rare cases, the CBD can compete with the benzodiazepine for that same receptor site, and actually make the benzodiazepine not work as well.
Oh, wow.
Interesting.
Not always, but it is possible.
Mm-hmm.
CBD can still cause dry mouth. For some people with very sensitive stomachs, sometimes it can cause a loose stool. And it's just a tool. It doesn't necessarily work for every single person. So to feel that it's going to work all the time is not not exactly 100% for everybody. And and I think CBD works a little bit better when taken with food. So for some people, the effects can be dramatic. So they might take it on an empty stomach and they are getting no benefit from it. And they switch to taking it with something in their stomach, and all of a sudden it does work.
Do you notice a difference between when people take CBD just by itself versus when they are, using an edible or smoking weed?
I guess it's going to depend on the disease state or what we're working on. For some people, the THC is important, and especially for pain conditions. Sometimes, maybe you guys have conversations with folks who operate in dispensaries, but sometimes the ideal blend is like a 50-50 blend of THC and CBD for pain conditions. So that would be, depending on what the person is coming in for, looking for support with, that ratio or proportion can vary. If somebody does not want to have the psychoactive effect whatsoever, then of course they would want to go with something that's more on the CBD side. Again, these are just tools, and I think our earth provides us with things that are an opening act, or in other words, something to entice us to then continue on that journey to cultivate whatever we need to through our own daily practice, from whether it's through exercise, some sort of meditative practice, food, etc. So.
Sure. I mean, well, that's super interesting, because I feel like a lot of the people that I've talked with that are using a CBD oil, they always claim that, it has no THC or like trace amounts of THC. But actually there might be some benefit to having, more of a mix of CBD and THC. It's not necessarily for a given individual. It may not necessarily be a bad thing having, a higher ratio or a higher quantity of THC relative to the CBD in there. So I think that's definitely something for people to keep in mind, that if especially if they're going to go, get something off the shelf or get something online, you're like, I've heard CBD is great for you and, great for pain. I'm going to try this CBD cream and whatnot, and there's no THC. So, well, actually for you, there might be a need to have some higher levels of THC in there, and based on how it's going to react with your body and what's going on. So I think that's a really important point that you bring up.
Yeah. And it's something that we can have that conversation about now as of 2020, whereas before it was a little bit more challenging to get access to that.
Sure.
So that is a conversation that will be ongoing. Yeah.
That's great. Matt, you've brought up this word compounding pharmacy. And I know I was very unfamiliar with this until I met you. So would you mind sharing what that means, and what would it mean if you weren't going to a compounding pharmacy? What are the differences?
Yeah, so in this area, there are a few compounding pharmacies in the area. There's one in Arlington Heights, one in Roselle, a few in the area, and they're designed to then work with the prescriber or practitioner to put together a customized order. Compounded medicine can be useful for many things, including our pets. So, for example, for medicine for cats, sometimes getting a medicine inside of a cat's mouth is close to impossible. So we can take that same medicine in powder form and incorporate that into a topical formulation. It turns out they have a good amount of vasculature in the hairless part of their inner ear, and you can take that same medicine, rub a little bit on it using a small dispenser on that inner ear, and then get the medicine in that way. For canines and other pets as well, similar concept, where you can add some kind of flavor to it to make it just like you would for kids, to add flavor to make them more likely to take their medicine. You can do the same thing for pets. So that compounded formulation allows us to either add some kind of special flavor or change the formulation so it's easier to use. In other cases, for patients with autoimmune conditions, there are certain drugs out there. Some very smart person figured out that a drug called naltrexone, when taken in small doses, can actually help to modulate the immune response through a few different various mechanisms, but basically it helps to reset the immune system. So for folks with autoimmune conditions like Hashimoto's or rheumatoid, etc., you can make naltrexone into a tablet or a troche or a capsule in a small dose. And the reason that a compounding pharmacy has to do it is because it's not commercially available in such a small dose. Naltrexone in the regular dose is used for other things such as alcohol dependence, etc. But in very small doses, it can help to recalibrate that immune pathway. And there really isn't any pharmaceutical conventional agent out there that does that. There are agents that will turn off the immune system, which can lead to a whole bunch of other side effects. But low-dose naltrexone is something that only a compounding pharmacy can provide. And because we've seen an upswing in autoimmune conditions, we'll probably be hearing a lot more about low-dose naltrexone in the years to come. So that's one way that compounding pharmacies can provide some benefit.
In a normal pharmacy, they just have to do whatever commercially is available. Is that correct?
That's correct. The low-dose naltrexone would not be available in a conventional pharmacy. They're pretty much just 90% of the work that a conventional pharmacy does is just on the computer, just trying to bill insurance and going through that whole tug of war between insurance provider, patient. So it can be, it can be frustrating, especially when you do get the medicine ready and you have to surprise the patient with a very high cost. So a lot of out of the box thinking, there is no room for a lot of out of the box thinking in a conventional pharmacy, but in a compounding pharmacy, sometimes again that collaborative experience can then allow some creative thinking, or you can go back to the literature and see what people have done. For example, I was talking to an owner of a compounding pharmacy earlier today, and they were for diaper rashes. It turns out that the reason that diaper rashes happen, or one reason is because babies or toddlers their gallbladder and liver aren't fully developed yet, so they're not able to do what they're supposed to do with bile. So a lot of bile will end up in the fecal matter, and that bile seems to be a little bit irritating to the skin. So somebody had this bright idea to use cholestyramine, which is a bile acid sequestrant. It binds to the bile. So you can take your customized diaper rash ointment that you make, add some of this powder, and from what I'm hearing or what I'm told, it helps to really clear up that diaper rash very quickly. Whereas with conventional products, there are some products out there, but they may or may not work as well.
Yeah. So you're bringing up a lot of cool stuff, like things that I didn't know you were going to talk about and I wouldn't have ever thought of. So how do people find out about this stuff? How would they know, maybe I should go over and talk to a compounding pharmacist and find out, you know what I'm saying? Like, you guys really think outside the box, and I'm not sure how would I know that I should, find someone like you.
Yeah. In any type of a marketing class, you learn about something called a SWOT analysis, right? Strengths, weaknesses, opportunities, threats. So in this environment, because it's an acute care model that has transposed itself onto a chronic care model and insurance-based, you really have to be a little bit of a searcher and a seeker, and either be fortunate enough to work with a prescriber who understands compounding pharmacy or has worked with compounding pharmacists before, or you have to learn about it on your own, or you have to just say, you have to sort of be a seeker and say, there has to be, maybe there's another way. And there are associations out there, like there's a company called PCCA, where a lot of compounding pharmacies acquire some of their raw material. So anybody can go onto PCCA. I don't remember if it's .com, but it stands for Professional Compounding Centers of America. They're out of Houston. So anybody, including any layman, can just go onto their website and learn more about it. And they can also then type in their zip code and, et cetera, et cetera. Then they'll give you a list of compounding pharmacies in your area. So that's just one entity, and because we have access to YouTube now, we can even learn about it on YouTube, or you can, just talk to a compounding pharmacist and see if there's any options. And sometimes there may be, and sometimes there may not be. But the challenge is that a lot of things aren't covered by insurance. So again, this is sort of something that we're investing in for better outcomes, hopefully long term. And if you're just one of those people who want everything covered by your insurance, then that's okay. But the certain options may not be there.
No, for sure. Now, Matt, if one of our listeners right now is thinking to themselves, The whole compounding pharmacy thing sounds really cool, but I don't really have one in my area. Is there something that they could, have a conversation with their standard pharmacist with, or what things could they bring up to their standard pharmacist when they go to pick up their prescriptions that may, obviously, it wouldn't be the same as going to a compounding pharmacy, but kind of may help trend them in that direction?
You could just ask your pharmacist if they know of any compounding pharmacy, and in most cases they may, and they'll be happy to refer you. You could also email us at info@wholesomerx.com, and we can try and find some compounding pharmacies in your area that you could reach out to. Again, at the end of the day, exercise, eating the right types of foods, doing some intermittent fasting, having a daily practice, these are all things that are free, and ultimately these are the things that have to be focused on for long-term improvement in the way we live. Compounding pharmacies, CBD oil, medications, these are all things that, can be really, really important. Even conventional pharmaceuticals are life-saving. There's no question about it. But these are all tools, and the goal is to continue to make progress and get everything that we need out of our own body.
So if you had a client working with you, Matt, and they might have a prescription from a doctor, maybe they don't, are you able as a compounding pharmacist to prescribe them or give them medication that wasn't necessarily given to them by their primary care or whatever doctor they're working with?
So thanks for bringing that point up. Every state is going to be a little different with respect to a compounded or customized prescription. No, a pharmacist cannot prescribe that. But if they have a good, strong working relationship with a prescriber who's open to the compounding pharmacy, the pharmacist can assist that process along and sort of create the formula and just have, then with the permission of the prescriber can sign off on it, either via fax or electronic or just a verbal approval. So no, a pharmacist can't just prescribe that order if there's a prescription medication involved. But if that experience can happen where we can bring the prescriber, the patient, and the pharmacy together, then in most cases the pharmacist can put something together.
Yeah. So I actually went to see Matt after I had our daughter Avalon, and I got a specific cream for scars for my tummy for postpartum. So was that a custom cream or something? Custom, what would you call it? A cream?
Yep. That was a custom cream, and that was only because of the doctor that you worked with, and that's up to you if you want to mention her name, but that was because of the relationship that you have with your doctor, who was Dr. McCormick. And if you had seen a different prescriber, I'm not exactly sure if that order would have come through.
Sure. Yeah, I just had mentioned to her, I'm like, what can I do for my stretch marks? And basically, you can read this all over online. There's very minimal research on anything that's actually productive for stretch marks. But she said, this might actually work. So she referred me to you, and I was like, oh, I know Wholesome Health. I'll go over there. So we made it happen. It was great. Yeah, and in your case, you already understand the importance of staying hydrated and movement and exercise. So a lot of those things probably played a role in healing time as well, of course. Mm-hmm. We always forget about talking about water, and you guys know better than anybody that staying hydrated is really important. Even if we consume a lot of nutrients to help us get better, those nutrients can't really get assimilated without the amount of hydration that we need, unless we have a specific condition like renal disease or something.
Sure. Now, Matt, is there anything that we haven't asked you that we should have asked you about your area of expertise?
We would encourage people when they get their medicine to get into the face of the person that is ringing them up at the counter, or the person on the phone if they get it through the mailer, and say, hey, what are the side effects of this medicine? Can this medicine deplete any nutrients? And what that will do over time is it'll force the person to learn. They may have the answer to that information about nutrients, or they may not. But if you push them and ask them the questions, and they keep getting the same question over and over, they'll have no choice but to learn and get the answer. And once they get the answer, they'll be able to share that with others, and so the whole system will get better that way.
I love that.
That's great.
Yeah, that's great advice.
It's kind of like movement by the people that are the purchasers, right? The clients.
Yeah,
exactly.
And that's hard because I don't know if you've ever walked into a big box pharmacy store, but it's kind of intimidating. Nobody's smiling behind that counter. They seem really busy and stressed out. So it doesn't seem like the right environment to ask too many questions, but it's okay. Do it.
I love that. So Matt, let's say one of our listeners is hearing you and they're like, you know what, I really do want to find a compounding pharmacy in my area. I would love to work with a pharmacist that has this understanding, this level of expertise. How can people find out more? How can people connect with you to learn more about, who in their area they should connect with, or, if they are in this area, where they can connect with you personally?
Well, a lot of what we do and a lot of questions we get are, hey, can you help me find a nutritionist or an acupuncturist or a doctor who can help us? And so I think the easiest way to do that is to email us at info@wholesomerx.com, and that's wholesome with a W. We can also get in touch with other customized or integrated pharmacies in your area and see if we can get you some information that way. So I think the best way is just info@wholesomerx.com, and we can try and steer you in the right direction.
Perfect. Now, the question that we like wrapping up with for all of our guests is, Matt, what is your definition of health?
At the end of the day, the most important thing and the thing that we're all reaching towards is a feeling of bliss internally. And that can be bliss that's focused on helping our family members do better. It can be bliss on helping us feel better. Whatever that is, that generates that bliss is where we're going. So if we can say, yes, we have a bad knee and we want to improve that knee, but the question is, why do we want to improve that knee? And there's a reason. We want to have more mobility. Maybe we want to spend more time with our kids or grandkids. Maybe we want to be able to play tennis. So whatever that is, it's to ultimately bring an internal joy. So everything that we do should be steered in that direction.
I love it. That's what we talk about so often here at Muscle Activation Schaumburg. That's what types of conversations that we have with our clients all the time. It's just helping people do the things that bring them joy for as long as they want to do them. And so I think that vibes exactly with, what we're thinking here at MAS. And so thank you for sharing all of that with us. Thank you for sharing your time, your expertise, your story. I mean, it was really neat hearing about, the world of a compounding pharmacist and, the potency of blending, not just like traditional medications with lifestyle stuff, but traditional medications with, actually other herbs and oils and minerals and things like that. And, how effective that can be at kind of customizing what people are putting into their bodies, what people are using on their bodies, and helping to promote health overall. So thank you for the work that you do. Thank you for sharing that with us. And we just really appreciate it.
Thank you. Thank you to you both. And I listen to your podcast and your social media posts, and I encourage everyone to do so as well.
Oh, thank you very much. Well, for our listeners, who do you know that needs to hear this episode? Who do you know that is looking for a compounding pharmacist or is looking for some alternative to just taking traditional medications? Share this episode with them so they can learn of the work that Matt is doing. They can learn where to connect with Matt, where to find other compounding pharmacies in their area. And while you're online, if you wouldn't mind, head on over to iTunes and leave us a rating and review. It helps people find us because we show up higher in those search results when people search for podcasts on exercise and when people search for podcasts on health. Well, thanks so much for tuning in. We always appreciate it. Have a fantastic week, and we'll talk with you all next week.